Okay, so starting off with the second part of the lecture, that is finance and dental care. So today we will be talking about the private third party prepayment plans. Okay, as I have already told, under this comes four things. The first one is commercial insurance companies, second one is non-profit health service corporation, third is prepaid group practice, and the last one is capitation plans. The second one, that is non-profit health service corporation, two things come under this. Okay, the first one is Delta Dental Plan, and the second one is Blue Cross Blue Shield. Okay, so we'll be understanding what basically the third party means. So, payment for services by some agency rather than directly by the beneficiary of those services. Okay, so the first party here is the dentist, second party is the patient, and the third party is the administrator of finances. Okay, third party is also known as insurer, underwriter, or administrative agent. Okay. Okay, so now talking about the third party payment financing here, it can be by the government or by a private carrier such as insurance companies. Okay, it is very easy to remember this basically. Okay, so like you can remember as if like government colleges are there, and along with that, private colleges are also there. Okay, so that way you can remember, like for third party payment financing care can also be done by the government or it can also be done by the private carriers such as insurance companies. Okay, so before understanding this definition, I'll just give you an example. Okay, it's basically a very layman example. So when we were kids, what our mothers used to do, that when any relative came and gave us money, our mother used to say that you just give me the money, and when you'll be needing it, I'll give it or return it back to you. Okay. So, in that context only, basically what insurance is here, what happens, group of people making small payments who become a big corpus when met with a catastrophic loss claim to the company, and in return they are paid by the company. Okay. So the basic principle, to be insurable, a risk must be precisely definable, be of sufficient magnitude, if occurs, should cause a major loss, be infrequent, be of unwanted nature, example, accident, fire, etc. And it should always be beyond the control of individual and not constitute a moral hazard. Okay, so basically three things are there. This is quite easy. You'll just understand it with the help of the word itself. Okay, you just have to focus on the words. The first one is deductible. Okay, it is also known as front end payments or flat sum pay. Like in this, what happens? Flat sum is paid. Okay, like a set amount is paid by the patient before benefits of program go into effect. Okay, the next one is co-insurance, which is also known as co-payment. Treatment cost is shared by the insurance company and the patient. Limitation of benefits is insurance carrier limit the range of services covered. Okay. The last one or the third one is group insurance. It is offered only to groups. Illness experience is reasonably predictable in a group. Okay. So it is not like mainly followed that last one, this group insurance. Okay. Okay. So this is an example of, see, the third party fees is paid. See, the total dentist fees is 100 rupees, and the third party pays 8 rupees 80, and from the patient to 20 rupees is collected. So this mode is, and among all these three, under which it comes under co-insurance. Okay, it is shared by the insurance company and the patient treatment cost. Okay. Okay, so here comes the next, that is reimbursement of dentist in third party plans. Okay, so it is basically by four things. The first one is UCR fees. This is very commonly asked question for the UGs. So what is the full form of UCR? Usual, customary and reasonable fee. The second one is table of allowances. Third one is fee schedules, and the last one is capitation. Okay. Okay, so coming to usual, what is usual fee, customary fee, and reasonable fee? See, This is the definition what I have put from Soben Peter, I guess. Okay, so you can find these definitions there itself. You'll just have to understand what it basically means. Okay, so coming to the first one, that is the usual fees. Okay, so it is a simple fee for service, whatever the dentist usually charges for a particular treatment by the patients. Okay, say for example, dentist charges rupees 1000 for oral profile access. Okay, so that's his usual fees. Okay, the next is the customary fees. Okay, so we'll understand this with the help of an example. The usual fee is 100 rupees. Administrator of a dental benefit program approaches a dentist with few patients like the dentist gives 20% discount on usual fees, that is the fees determined by the administrator of a dental benefit program. Okay, so the usual fees 100 rupees. Okay. The like administrator of finances asks the dentist that he will be giving discount if he will be giving him some patients if he'll be giving 20% discount on the on his usual fee, that is 100 rupees, and after 20% discount it will be rupees 80 for that particular treatment. Then that is his customary fees. Okay, 100 rupees was the usual fees and 80 rupees was the customary fees. The third one is reasonable fees. Okay, so customary fees, as I have already told, it is 20% less than the usual fees in the example I told previously. Okay. Okay, so coming to next, that is reasonable fees. See, say for an example, a dentist starts doing an extraction, okay, and finds that the tooth is impacted or some additional complications are there. So some additional procedures will be required, like more extensive treatment and more expertise, and along with more equipments will be required. So the dentist can charge the patient based on the like whatever additional treatment or additional equipments he has used, he can charge the patient for that. Okay, so it is different from the usual and customary fee. Okay, so what a reasonable fees actually means. Now we'll come to the definition. What the definition of these three says. Okay, so coming to the definition of usual fees, that is the fee that an individual dentist most frequently charges for a given dental service. Okay, and the definition of customary fees is the fee level determined by the administrator of a dental benefit plan from actual submitted fees for a specific dental procedure to establish the maximum benefit payable under a given plan for that specific procedure. The last one, that is reasonable fees, is the fee charged by the dentist for a specific dental procedure that has been modified by the nature and severity of the condition being treated and by any medical or dental complication may differ from dentist's usual fee or the benefit administrator's customary fee. Okay, okay. So this is the example of reasonable fees, but I've already told. Okay, so the next one, that is the table of allowances. What it is? A list of covered services with an assigned amount that represents the total obligation of the plan with respect to payment for such service, but that does not necessarily represent the dentist's full fee for that particular service. Okay, say for an example, dentist's usual fees is rupees 1000. Okay, so the plan list fee for that service is rupees 750. So the dentist can charge he may or may not charge. Okay, like mm, he can ask the patient to pay the rest 250 rupees, or he may not also ask. Okay, but 750 rupees is the amount he will be definitely getting for that particular treatment. Okay, so this is the table of allowances. A pre-planned list is given, okay, with the amount. Pre-planned list of the services covered with the pre-decided amount. The next one is fee schedules. So it contains a list of charges established or agreed to by a dentist for specific dental services. It is also known as service plans. A fee schedule is usually taken to represent payment in full, whereas a table of allowances, as just explained, may not. See, the a list of charges is established in both the table of allowances also and the fee schedules also. The only difference is in table of allowances, the dentist may or may not charge his remaining payment what he usually charges, what is the usual fee for that particular treatment or that particular service. But in fee schedules, he cannot charge the extra amount from the patient. Okay. See, here also the list of charges are established beforehand only. Okay. As in table of allowances. I hope you are getting the difference between table of allowances and fee schedules. Okay, so coming to next, that is capitation. See here what happens. Fee is usually a fixed monthly payment paid by a courier to a dentist based on the number or patients assigned to the dentist for treatment. Okay, capitation requires that patients be assigned to specific dentist or dental practices for care so that the capitation payment can be paid to the appropriate dentist or practice. See, it is a basically it is nothing a fixed monthly payment is given by the carrier to the dentist for the number of patients he treats. Okay, okay. So as I've already told, the private third-party prepayment plans are further categorized under four things. The first one is commercial insurance companies. These are the companies which operate for profit. The companies directly pays the dentist, okay, for the provision of covered services. Payment is quicker, and CIC in India has started providing insurance for dental procedures which do not require hospitalization. Okay, like when these companies were started, these included only those dental services which required hospitalization. Okay, but nowadays insurance for general dental procedures have also been covered or provided to the general population. Okay. Okay, so CICs in India, basically it can be governmental or non-governmental. Under governmental comes four things. That is the first one is CGHS, that is Central Government Health Scheme. The second one is ESIS, that is Employees State Insurance Scheme. The third one is Railway Employees Healthcare, and the last one is Mediclaim. I will be talking about these in my further slides. Okay. Okay, so some of the examples of CICs are ESIS, I've already told this, GIC, Mediclaim Policy of the General Insurance Corporation, Apollo Munish Health Insurance, Star Health Insurance, Max Bupa Health Insurance, Bajaj Alliance General Insurance, HLL launches Pepsodent Dental Insurance, Life Insurance Corporation, Health Protection Plus Entry. Okay, so the second one in the private third party prepayment plans is non-profit health service corporations. Okay, so I've already told under these comes two things, Delta Dental Plan and Blue Cross Blue Shield. Okay, so talking about the Delta Dental plans, these are also known as Dental Service Corporation, started as a National Association of Dental Service Plan in June 1966. The name changed to Delta Dental Plan Association in April 1969. Coming to next, the purpose of these were to provide comprehensive dental care program for children up to 14 years of age. The members were the dentist or the board of directors, representatives of the world of finance, insurance, labor and consumer groups. Okay, so reimbursement of dentist in these were by UCRC. Functions of these were in basically two. Okay, ensures the quality and care provided, keeps the cost within limits. Okay, so talking about the reimbursement of dentist, like how it was done. It was obviously done by the UCRP, but under these also again comes two terms. Okay, this is very important from the exam point of view, so please pay attention. So coming to the reimbursement of dentist, this is basically for two dentists. Okay, the first one is the participating dentist, and the second one is non-participating dentist. Participating dentist means any duly licensed dentist who has contractual agreement with the Delta Dental Plan. Okay, to render care to covered subscribers. Okay, so what are the conditions for participating dentist? Pre-filing of their usual and customary fee, payments at 90th percentile, conducts audit, post-treatment checkups, withholds some money, goes to Delta Capital Reserve Fund. Okay. Now talking about the non-participating dentist. Okay. So they can also treat the Delta dental uh, plan patients, but the only difference will be they will be paid at 50th percentile. Okay, the participating dentist will be paid at 90th percentile, whereas the non-participating dentists will be paid at 50th percentile. Okay, so basically they do not need to pre-file their fees and not subject to fee audits. Okay, so we'll again just have a recap of both of these. Reimbursement of dentist in dental plan includes two types of dentists, the participating dentist and the non-participating dentist. The participating dentist includes any duly licensed dentist who has contractual agreement with the Delta Dental Plan. Okay. And they will be paid basically at 90th percentile. Okay, I'll be telling about what this 90th percentile in my further slides. Okay, so coming to the next, that is non-participating dentists. They can also treat the Delta Dental Plan patients, but they will be paid at 50th percentile. Okay. Okay. So coming about the 90th percentile, we'll just understand with the help of this graph. Okay. So in an area, there is 1,000 participating dentists and fees ranges from rupees 50 to rupees 90 for oral profile access. Okay. X-axis here shows the fees and the y-axis here shows the percentile. So the percentiles of a data set divide total frequency into hundreds. 90th percentile is basically the value below which 90% observations lie. Okay, so here the value for the 90th percentile will be like a bit less than rupees 80. Okay, it is somewhere 78 or 79. Okay, so that is the 90th percentile or 90th percentile fee that will be paid to the participating dentist. Okay, so coming to advantages of Delta plans, this includes control of cost, quality assurance procedure, and there's no need to pay extra. Okay. Thereby, basically encourages regular attendance and maintains good dental health of the society by various services. Okay, this I have already told. Okay, so coming to next, that is Blue Cross Blue Shield Association. This offers limited dental coverage, has similar cost control features pioneered by Delta plans. Dental coverage are limited to services provided in the hospital, constituting minor proportion. It does not put its hand into dental prepayments. Okay, so you have to just remember this last point. It sometimes comes in MCQs. The Blue Cross Blue Shield Association does not put its hand into dental prepayments. Okay, coming to next, that is the third one, prepaid group practice. Okay, it is a group practice that provides dental services on a prepaid basis. These are also known as open panels. So what the definition says, given by American Dental Association in 1969, it is basically group practice. It is basically that type of dental practice in which dentists, sometimes in association with the members of other health professionals, agree formally between themselves on certain central arrangements designed to provide efficient dental health services. Okay. So, coming to net income in a group is divided equally and paid according to patient load, years of service, specialty status. The advantages of these are basically it is multi-speciality. The dentist can enjoy vacation leaves. In case of illness, less disruption is caused. Quality will improve because of built-in peer review. Financial benefits like sick leave and pension plans. Okay. So there are basically three types of group practice. The first one is general group practice. Second is single specialty group. The third one is multi-speciality group. Okay, so talking about the first one, that is general practice group. Here what happens, the basically general practitioners by their mutual understanding forms a group. Okay, and the next one, that is single specialty group. See here the group is formed by single specialty people. Okay, so you can like say for an example, uh, group of prosthodontists. Okay, so they are like from a same specialty and they form same specialty and they are forming a, single specialty group. Okay, so the multi-specialty group basically includes like in people from different specialties. Okay, so like say for an example, dentist also, dentist along with the general medicine people, along with the optha people, they basically forms a multi-specialty group by their mutual understanding and agreement. Okay. Okay, so examples of group practice. The first one is Milestone Dental Clinic, that is first in India to be established. Okay, the second one was Vasan Dental Care Hospital, which was first multi-speciality dental hospital in India. Under this comes a very important term, that is health maintenance organizations, also known as HMO. Okay, so what the definition says, HMO is basically a legal entity which provides a prescribed range of health services to each individual who has enrolled in the organization in return for a prepaid, fixed, and uniform payments. Okay, so HMO basically consists of five things. The first one is a managing organization. The second is a delivery system. Third one is an enrolled population. Fourth one is a benefit package. And the last one here is a system of financing and prepayment. Okay, so talking about the managing organization, this basically manages, okay, both the dentist and the enrollees. Enrollees, you can see the population or like the people or the patients or general population who has enrolled with this entity, okay, or with health maintenance organization. So there's a managing organization, a delivery system. A delivery system is basically through which the services are delivered. ठीक है, it can be like I'll be talking about this in my further slide. The third one is enrolled population. As I've already told, the general population of the patients who have enrolled in this HMO, a benefit package like a list of the services along with the charges, like whatever the benefit they will be getting if they enroll in this HMO. And the last one is a system of financing and prepayment. Okay, that is like how the dentist will be receiving the payment. Okay. Okay, so talking about the delivery system, so it is basically uh, provides comprehensive health maintenance and treatment services. This can be given in terms of primary care, emergency care, hospital care, and rehabilitation. Okay. Okay, so what are the different types of dental personnel in HMO? Basically, there are four models. The first one is staff model, second is group model, third one is IPA, that is Independent Practice Association, and the last one is primary care capitated network or direct contract model. Okay, so talking about the first one, that is the staff model. Here, dentists, dental hygienists, and dental assistants are salaried employees. Okay, and what happens in group model? HMO along with group practice. Okay, they just get their agreement done with the group practice people for the provision of the dental service, HMO. Okay, the next one is Independent Practice Association. Here, what happens? Association of Independent Dentists that develops its own management and fiscal structure for the treatment of the patients enrolled in an HMO. Okay, so see what was happening in group model. The group of practitioners uh, were in agreement with the HMO for the provision of the dental services, whereas in Independent Practice Association, the independent dentists develops its own management and fiscal structure. There was the dentist of group practice, and here the dentist is like the independent dentist. Okay. Okay, so they develop their own management and fiscal structure for the treatment of the patients enrolled in an HMO. Okay, the last one is primary care capitated network or direct contract model. It is also similar to independent practice association, except that HMO contracts directly with individual provider for provision of the dental services. Okay, so here what happens, HMO contracts directly with the individual provider, okay, for the provision of the dental services. The next one is capitation plans. So here what happens, the dentist receives an established negotiated sum on a monthly or yearly basis for each liable patient. Okay, the money is paid regardless of whether the patient utilized care or not. In return, the patient is entitled to receive a prescribed set of services over a specified period of time. Okay, so the what it basically means, the capitation fees. It is fixed monthly or yearly payment. So paid by carrier to the dentist for the treatment. The disadvantage of these are basically fear of overutilization, and the patient may also demand for expensive treatments. Okay, so coming to evaluation, this is basically for what you have just understood from this lecture. Okay, so this is the scenario one where the patient visits dental clinic and undergoes the treatment as suggested by the dentist. Payment for the services availed is done by some agency rather than the patient or the beneficiary of these services. Mechanism of financing hence followed will be, see, the payment is done by some other agency, okay, like some third party. So what will be the mechanism of financing? Private third party prepayment plans, okay. Okay, so the next question here is other term for front end payment is this is the direct question I have put. Okay, I had told this in my previous slides also. Deductible. Okay. So this is the third scenario here. A patient enrolled with Delta Dental Plan avails dental treatment by a participating dentist. Okay. So the participating dentist will receive payment at 90th percentile. Okay. And the non-participating dentist will receive payment at 50th percentile. Okay, as I have already told.